Sir, start. नहीं ऐसे देखते ना पीछे A very good evening to all of the doctors. Thank you so much for joining us for today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. This is an invite from Cadila through the innovation to serve uh, the topic of the webinar is dosage reduction strategy in rabies management, rule of naval vaccine. With this is my honor to introduce you the speaker of today's webinar, Dr. Ashok Kumar Agarwal, specialty MD Medicine. He is the 30-year practitioner in Gorakhpur area. Now I would like to request Dr. Ashok Kumar Agarwal to write the talk, and later on we will have question and answer session. All the participants can drop their question in the drop box, and we will read out all the question after the presentation. Sir, please start. आप बैठिए पहला यही है उन्हें हाँ नीचे वाला करेंगे हाँ हाँ नीचे करेंगे लगा
Good evening and welcome to all the delegates participating in today's webinar. The topic today is novel 3-day gene protein vaccine, which is an ultimate key for compliance. As we already know that rabies is a genetic disease and we can only vaccinate the person to protect future infection. Now, rabies is a public health challenge in India. Globally, 59,000 human deaths has been recorded annually, and which is highest in India. As we know that in India, stray dogs are very popular. India has 20,000 human deaths a year from rabies, accounting for 60% of rabies deaths in Asia and 35% globally. 91% deaths in India occur in rural areas. Now, what is the current management? The current management is local wound treatment, which is for first aid. Second is active immunization, that is vaccination. And third is passive immunization with RIG. Lately, 5-dose intramuscular regime was recommended, but now with advancement, only 3 doses is sufficient to cover the infection. Now, what are the current challenges of first is non-compliance? Second is current vaccine are cell culture vaccines, that is CCV. Inactivated vaccines are more than 50 years old technology. They are inconsistency in potency, stability, availability, that's short supply, and adverse events. Now, the compliance in anti-rabies vaccine, the compliance who receive the full course of ARV, that is the scheduled dose of ARV, the recommended dose. Delayed compliance who completed the scheduled dose of ARV within 60 days but deviated from the scheduled regimen. Now, dropouts, that is non-compliant, who had taken at least 1 dose of ARV after animal bite but not completed all the scheduled doses. Non-compliance to 3 dose, that is proven case of death. The reason of deaths may be due to lack of administration of rabies immunoglobulin or poor compliance to vaccination. Compliance to post-exposure prophylaxis among animal bite patients. A hospital-based epidemiology study by Mansi Panda and Richa Kapoor at Safdardjung Hospital, New Delhi. Number of patients were 360 animal bites. A pre-designed, pre-tested structured questionnaire was administered by the interview technique. 53% were non-compliant to the full course of ARV. Compliance to anti-rabies vaccination in post-exposure prophylaxis at Municipal Corporation Hospitals, Bangalore. Number was 215. 1 dose of rabies vaccine administered intramuscularly on days 0, 3, 7, 14, and 28 as PEP. Also measures constraints for compliance to complete course. The compliance rate for intramuscular rabies vaccination was 60%. Constraints for compliance to complete course of anti-rabies vaccines. Interferes with the school timing, that is 11%. Distance of the hospital, that too is 11%. Cost incurred was 13%. Forgotten dates, 18%. The major constraint for compliance to complete ARV was loss of wages. Evolution of rabies vaccine. First is nervous tissue and second is cell culture. Live attenuated vaccine taken from spinal cord. Second is inactivated vaccine. And third is cell culture inactivated vaccine, that is cell culture more than 2.5 international units. The live attenuated vaccine was in 1885. In 1911, that was inactivated vaccine. And in 1976, cell culture inactivated vaccine was there. Non-compliance led to evolution in treatment regime from 31 dose to 5 dose and still on. Meeting the unmet medical need, introducing a novel vaccine with simple and shorter regimen. Novel 3-dose recombinant rabies G protein vaccine. First vaccine with 3-dose intramuscular regimen taken on 0, 3, and 7 days. Just 3 doses in 7 days, prepared by VLP platform technology. Better compliance due to easy to follow regimen and less visits. First protein subunit vaccine. Convenience, ready to use, no constitution is required. Novel 3-dose recombinant rabies G protein vaccine. VLP technology. VLPs are similar to native virus particles but that do not contain the viral genome. G protein is difficult to stabilize. So G protein isolation using VLP technology purified and stabilized by Cadla Pharmaceuticals Limited. They are capable of inducing a strong humoral and cellular immune response. We can see that there is a native virus-like particles, that is VLPs are protein complexes, exist as nanoparticles. They cannot replicate but can mimic the viral antigenicity without being pathogenic. Clinical study phase 3. This study shows the safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization. A randomized comparator-controlled multi-center phase 3 clinical study. Phase 3 study to evaluate immunogenicity and safety of rabies G protein vaccine was administered as a simulated post-exposure immunization in healthy volunteers. Randomized comparative controlled multi-center study. Total subjects were 800 and randomization was done in 2:1. TH rabies 0-3-7 days regime, 1-3-7-14 and 28 days regime, and in 533 subjects, and in previous one it was 267 subjects. The reference was Rabipur. What were the results? The results were consistent across different age groups and genders. Observed difference was 1.52%. Non-inferiority for seroprotection. Primary endpoint day 14 and 42 were met. Test and comparator are identical in seroprotection rate both on days 14 and 42. Next. What was the study conclusion? The conclusion was novel 3-dose was non-inferior to reference vaccine. There were less adverse effects compared to reference vaccine. And the novel 3-dose was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. Now the awards for this innovation, the Pharma Innovation of the Year Award by the Economic Times, the Golden Globe Tigers Award, Malaysia for Innovative Product of the Year. Thank you. बात कर रहे थे आप लोग क्यों आवाज मेरा ठीक थी ना क्लियर था कोई प्रॉब्लम नहीं थी ना
All the participants can drop the question in the drop box and we will read out all the questions after the participants. Any questions participant have? Any?
तो फोटो नहीं आता
Thank you. Any question you have? No. Thank you so much, you Dr. Ashok Agrawal, for the informative talks. To appreciate your effort. Last but not but not the award innovation categories ET and award and Golden Global Tiger Awards. Thank you so much, all participants. Thank you. Thank you. Thank
कितने लोग participate किए थे?
उसका एक अलग लिंक है सर।
कितने लोग participate किए थे?
अभी सर उसमें डाटा आया
सब नहीं, गौतम के बाद